Come to the live chat, Vicky. Come to the live chat. Wait a minute. Oops. I'm putting the live chat link in a live chat link. I'm already here. I got 21 people in the live. Whoa. "21 people in the live chat and 1 thumbs up. What's the deal with that?" There's 5 thumbs up out of 27 people. No, you can thumbs down if you want to. Maybe you don't like the color of my shirt. I don't know. Joe Mueller, you said you got an English assignment. That was perfect, man. You know what? Somebody called themselves, commented on the video that I did, and they called me a dumb A, okay? But they put Y-O-U-R, right? They put Y-O-U-R, the letter A, and they called me a dumb A. And I responded back to them. I said, I pretty much, I forget what I said, but I said something on the notion of, Y-O-U apostrophe R-E or Y-O-U-A-R-E. That's what you mean. I was like, so who's the real? So that was like, I don't know. That's why I said this happened twice to me today. Where'd that person go? Where'd the grammar go? That was perfect, man. That was absolutely perfect. No, but somebody, where did Kate? Okay, Kate, you went. Okay, you here. Kate. Yeah, exactly, JT. He went to go visit his grammar. Oh man. Oh no, but seriously though, no, Kate, what's going on with you, sis? Kane, yeah. That was awesome, man. No, it's just I probably if you guys go back and look at a lot of my videos, you're probably gonna see a whole bunch of stuff spelled wrong. But it's just the fact that somebody was trying to tell me to work on my grammar and they spelled grammar wrong. The irony of that was just awesome. Hmm. Yeah, we make mistakes, but it's some we make some makes. Right. I'm not drunk, Ossifer. Grammar got ran over by a reindeer. Y'all are crazy. No, Kate, I thought you said you had something going on and you were about to leave out of the chat room earlier. So I thought I was just about to address whatever it was. Possibility. But no, some of y'all was asking about the CBD oil. I have quite a few patients that actually take it and they swear by it. So, boy, that was funny. Oh, it got too squirrely. Don't say squirrely around Auntie Deshika. Address what dress? Exactly, Drew. You crazy. There's these gummy bears. There's this cream. She swears by it though. She has MS really bad. Yep, Johnny Techno with THC. But most people just do the real stuff. JT, some of them say with their arthritis, osteoporosis, definitely like multiple sclerosis, and just overall general chronic pain. But they have these people have like a cream they use, and then she do the I know Joni is a female. I always do that to them. Call them Johnny Techno. I know it's Joni. It's just like an ongoing joke now for me. For neuropathy, it all depends. If neuropathy is in the field, I know a lot of people use something called an anodyne. It's infrared treatment, and that works really good on that. Circulation. I guess it's a way of the blood to supply the nerves nutritionally. So, can you guys hear me pretty good? Like you guys hear me right now, right? But if I put the microphone right here, no, Kate, you can look it up online and find anodyne. You probably can find it on Amazon or something like that. You guys, a lot of this stuff that you wouldn't even think that you can get it online. I mean, the world has changed now. A lot of things that be in doctor's offices and all that. Nope, they have it on Wow. They have it on Amazon. They have it on Amazon. I'll show you right now. That's it right there. Right here. These little pads right there. They would go like on the bottom of your feet, depending on where you got the neuropathy at. And you would turn these little dials right here up to like level 8 or something like that, and you leave it on there for a certain period of time. But that right there is called anodyne. See? Yep, Scott McClellan, absolutely. Yep, Sin Hatamaker is called anodyne, just like that. Oh boy, who got some pure opium? Oh boy. I know where you can get it from. I know a few family members that know. A tethered spinal cord. Oh my God. Holy smokes, Jojo boy. Man. Dr. Vicky still in here? Oh man, wait, somebody said something about having IC. Yeah, I've heard of people with IC. We actually had to go through a course in therapy where somebody just asked something about a tethered spinal cord or something like that. So you might be able to offer your expertise on that. That's a little bit out of my range. I know about it, and I just know they try to treat it with a lot of times non-steroidal anti-inflammatories. But somebody that had IC, I know that's dealing with. I know we learned about that in women and men's health about the IC. Now, what I was asking you guys, okay, like right now, can you guys hear me just as clear? With the microphone being down here, can y'all hear me just as clear? Some Jackson juice, it was IC. Oh yeah, Kate, it's gonna cost. It is going to cost. Joe Mueller, I hate to hear that, man. That's a bladder issue right there. A lot of recurrent scarring, almost like lesions or something like that. The whole point of it is with something like that, they need to know what could be something that might be exacerbating it to actually cause that. You know what I mean? Sin Hadamaker, it won't hurt it will not hurt to do it. They pay for TENS units and all that, so it might be a good chance. They might have your doctor actually prescribe that you get anodyne and see if your insurance will cover it. All they can say is no. They might cover a portion of it. Y'all will be surprised by a lot of things that the insurance will cover. Yep, JT, that's exactly what we're talking about. Yep, interstitial cystitis. Yep. It's that bladder issue, real bad. Okay, so I guess it sounds better now. Does it sound better to you now? Hell. Yeah, I know, JT. High blood pressure, high anxiety, scoliosis, and other problems. I tried TENS units and pain meds, and I find Mary Jane works wonders. I bet. Oh, y'all getting the transfer board? A sliding board you talking about? Yeah, cortisone. The thing is, though, is that, it all depends. With a cortisone shot, it masks the pain, but it tricks you, and people think that because it feels better, they think that it is better. So you can have like a damaged spinal cord. You get a cortisone shot in the wrong. I mean, you get a cortisone shot in that area. It masks the pain, but you still could be doing damage to your spinal cord. And the thing that won't happen is that signal won't get sent to your brain saying, hey, it hurts down here. So by the time the cortisone start to wear off, all of a sudden it's excruciating pain. Spinal cord damage can be even worse. Mary Jane makes your grammar Murray. Yeah. Man, what is up, guys? So many people. I'm sick and messed up. Is there anybody in this chat room out of the 46 people in here? Is there anybody in here that don't have anything that's going on with them? I mean, I'm not trying to say it in a bad way. I just want to know. Like, is there anyone in here that you don't have no issues, like, at all, besides me? So I mean, so all the ones that say they don't have no issues going on, so no depression, no back pain, no anxiety issues, no agoraphobia, no. Okay, I just want to know. It's nothing against nobody else that does, but I was just wondering. Most people without issues are probably out doing stuff. I'm here doing stuff with you guys. I don't have no issues. Nope, I'm Scottish. Whoa, man, Joe, that might be, yeah, you might be right. Oh, Vicky, no, I have none. Absolutely none. Absolutely, Kate. It's just what's cool about this is that if there's anybody out there that don't have no issues going on, they can be like those people that can help whenever we're all in here and we're discussing issues. Of course, you guys all perfect as in health wise. Yeah, I don't have no health issues. I don't have no depression issues. I don't have no anxiety. I seriously don't have anything. I'm not lying. Dead serious. That is the God honest truth. Vicky, I know you've been on here not too long, but I have a story that I know you was. I know Vicky, I know you joking, doctor. I can tell. I know you're not one of those ones. No, I haven't done it. Just that I guess the thing with the investing, I just never really, I never really just thought to talk about that. I've never talked and somebody taught it to me. A rich man taught it to me and I know how to do it. So I just never really thought about teaching. It's just like I don't teach people about budgeting their money. You know what I mean? So I put that in the same category. Like I don't, that's what I'm getting at pretty much is that I never just thought in my head, should I talk about doing covered calls one day? Or should I talk about how to budget your money one day? I never talked about that before. So it just never crossed my mind. That's all. Oddest fighter, you have 2 herniated discs. Depends on how many millimeters out. That's really not a big issue. We can fix that. Maybe take a month or 2, but it can be fixed. Yeah, there's nothing wrong with people having issues. I just wonder because that means everybody else that don't have no issues, we can be a lot more supportive to the ones that do have the issues. Y'all know what I mean? Yeah, it's just when they get past a certain amount of millimeters, like you're talking 4 or 5 millimeters herniated, and they start to press on that nerve and send that sciatic shock down the legs. Now we have an issue. How do you fix herniated disc? Well, it depends. You would have to let me know what's going on with you. I would have to make sure that you don't have no hardware in your back, like fusions or anything, or any, um, foraminal issues. And I got to make sure that you don't have nothing like stenosis too. So, but if you just got herniated disc and that's all, you don't have no hardware in your back, you don't have no stenosis, you know, no spurs or anything like that, then I can tell you what you can do for your back. But if you got surgeries and all that, then we will have to. Man, Carol, that's terrible. That means somebody cut something wrong. Holy smokes, Penny. Woo! Susan, you crazy. Two viewer, you can still lift weights. You just gotta do light rep. You gotta do lightweight and high reps. Absolutely, Dr. Vicky. I see it all the time. That's why when people get a herniated disc and when they come and I tell them, ask your doctor, according to that MRI that they did, I want to know how many millimeters is your disc herniated. Oh my God, they will go. I mean, you can have like a 2 millimeter disc herniation. They want to go and do surgery. I mean, they don't even need it. And like if that annulus fluid inside that disc is not busted open and stuff is spurting out, the annulus fluid is not coming out, we can fix it. Did you say 4 torn stenosis? Oh man, so Teresa, you don't need to do any type of back bending. What's going on, Cynthia Bastarmante? Oh my gosh, Carol. JT, you might want to walk only at like a mile and a half. A mile and a half and put the treadmill at 2. Well, David Lanterman, stretching can help the lower back, but it all depends. If you stretch a certain way, it can actually cause exacerbation of the symptoms. You know, like for stenosis, you don't want to do no back bend. But for a herniated disc, you don't want to do no flexion. But if you got a combination of both, you're going to have to roll with doing more of the flexion than you are the extension. So, yeah, really, yeah. I see what you're saying with that, but yeah, it's a matter of you talking about stretching the back. Absolutely. The inversion table works well. So does traction, mechanical traction. Hell, you're terrible. You're just terrible, terrible. Strengthening the hip muscles, doing hip adduction. Well, it all depends on what you need to strengthen the hip muscles. You can take a ball, and put it between your knees right here and squeeze it and hold it for 3 seconds. Matter of fact, like how I am right here, if you sitting at the edge of this chair with nice posture, you sit up at the edge of the chair like this right here, right? And you're going to take a ball and put it right here. You squeeze on the ball and this part of your stomach right here, you pull it in even harder like this right here. You hold your stomach in, squeeze the ball for 3 seconds, and you do a Kegel. So it's going to go squeeze the ball, do a Kegel, pull the stomach in, hold both of them for about a good 3 to 5 seconds, and you see that I'm still breathing because I'm not using my diaphragm to, I'm not doing that. I'm using the stomach muscles right here, the transverse abdominis muscles and the deep pelvic muscles to pull in, do a Kegel, squeeze the ball, hold for 3 seconds. You do that right, you're going to actually feel a little bit of tugging in your back because those muscles in the hip flexors actually go to the back, called the iliopsoas. They actually go to your low back and attach to your low back, and they got something to do with the stabilization there. And the transverse abdominis muscle that you are contracting, it goes like right here, it's like here, and it goes all the way around, and it attaches to your low back as well. So doing those 3 things right there can actually help the core and the trunk at the same time. So again, you're sitting at the edge of the chair like this, you squeeze the ball, you do a Kegel, you pull the stomach muscles in, like here, you pull in, and you hold for about a good 5 seconds. Then you relax all 3. The ball, do a Kegel, pull the belly button towards the spine, hold it all for 3 to 5 seconds. You still should be able to breathe like I'm talking to you right now and holding the stomach in. That's real good for the trunk and the low back at the same time. It's called anterior draw-in maneuver. So. Tube viewer, I just gave it to you because hernia is pushing out. What I just showed you is it's called an anterior draw-in maneuver. So imagine if you lay on your stomach, imagine pulling your stomach away. So you're not sucking in going, you're actually using your stomach like I am sitting right here. I'm just pulling in like that. See that? This is my stomach being normal right here, right? And all I'm doing is just pulling in like that. Nothing there. Letting it relax. Pull in just like that. Relaxing. Pulling in just like that. I don't know if y'all can see that well, but I haven't heard anything really about the Prilosec lawsuit. I didn't even know what was going on. Oh yeah, when you drive, you need to be sitting back. But I would just suggest, depends on what type of back issues that you got. You might want to get like a lumbar roll and put back there so you don't ever see. Y'all notice I got a pillow right there. You don't ever want to be sitting in the chair while you're driving and being like this. That's the worst you can do that's the worst you can be is slump. And everything is going to be coming from this low back. So see how I'm sitting here right now, right? You see how I'm sitting here? You should never be sitting in your chair and your back be curved like this. That's a setup for any kind of disc herniations right there. So you're sitting in the car like that, and then when you go home, you sit in a nice soft plush couch and you're sitting like this right here. You guys can go back and watch any of my videos. I guarantee y'all never caught me sitting back in this chair like that. I always have this pillow right here back there as a reminder. So when I sit against this pillow, I'm always sitting like this. I'm never sitting like this right here, ever. I got too many patients that come in with too many back issues that I already know there is no way I'm going to be like that. I noticed that a lot of people that have a lot of organ issues, it all came from the back. See, I told you guys that the back, the spine is one of my specialties. So this is what we find. You know how y'all see people that got the old person problem? You know, you see them with a rolling walker and they're bent over like this right here, right? And so you look at that and you feel like that might be like a deformity, but in all actuality, it's not necessarily a deformity. It's actually your body conforming to the shape that is used to you being in. So just think, years and years and years, you got people that might have an office desk. They're sitting at their office desk like this. They're typing, right? And especially if they're a young person. Then they drive in their car. They're back like this again while driving, right? Then they go home and they might play video games, or they might be watching TV and having a beer. They're sitting with their legs up like this, and they're in that slump position again. So years and years and years and years of doing that, we don't call it a deformity. I call it a conformity. Your body is conforming to the shape that it feels that you want to be in all the time. You know, if you sit there and you sit there and you keep your arm in a certain position for a long time and keep it there, your body's actually going to feel like that's where you want your arm to be. So it ends up getting stuck that way. So it works the same way with the spine. The only difference is the spine is your foundation. OK, so if the foundation starts to break down and you start to find yourself being like this, now your kidneys are being compromised, your liver is being compromised, your lungs are being compromised, your heart is being compromised, your gallbladder, your spleen, everything, your intestines, everything is being compromised now because everything is right in here, right? And if everything starts to break down and you sitting here like this, you jeopardizing your organs. Absolutely. Contractures can definitely happen, and muscle atrophy. You're going to end up having to where everything here is real tight and everything back there is real loose. So that's why I kid you not, like 80% of my patients that come in, most people, forward shoulders, they got kyphosis, and then they slump forward like this. And that's their posture. Most people sit there and they stand like this. Nobody is really up and back like this. Most people are like this, shoulders forward, and they walk, they're just like this. So some people from the old school, if your parents ever told you about being posture, sitting up tall, shoulders back, they were absolutely right. Because I'm telling you, once that spine starts to break down, that vertebrae starts to break down, and you being slumped like this, rest assured you're going to end up having some, most likely going to be having some organ issues. If Starry Night, if you wear shoes and your feet start to cramp, that means you need to get some customized orthotics. Dr. Vicky, why is it that people, I thought that was just like a saying. They say doctors are the hardest people to treat. Y'all like, I know what's wrong with me. I got contractions, and guess what? I'm still not moving it. But then like therapists, I'm gonna be like, well, doctor, I'm sorry you about to cuss me out, but I don't care. I'm about to stretch that leg out. You, oh my God, you mother poop. Get your hands off of me. I'm gonna kick your poop. So, but I'm just like, keep on cussing me out. I'm still gonna stretch that leg though. I'm still gonna stretch that hamstring. You can smack me, you can throw stuff at me. I'm still gonna stretch that hamstring. Keep on cussing. I'm gonna really flex your leg back. What'd you say? Say it again. Go ahead. Ah. So I'm just kidding. I don't do that to my patients. I hear you, Joe Mueller. Jaju boy, the vest to help correct your posture, it does work. But here's the thing though. The vest will begin to do what your muscles are supposed to do. So if you wear that vest, only supposed to be for a temporary thing to help you with your posture. If you consistently wear that, your muscles are going to shrink and atrophy because they don't need to do the job no more. You know what I mean? So if I put something on that keeps my body upright all the time, what you think is going to happen when I take it off? Boom. Everything going to drop. The muscles don't need to work no more. If they don't need to work no more to keep your body stabilized, then you're going to continue to wear that vest. That's why, like, what I do, I'm all about progression. I'm not about degressing or digressing. You know, I want my patients to improve. So if you're talking about having like, you know, like a walker, if you keep on using a walker, your muscles aren't going to be able to work efficiently enough because they're going to be relying on that walker to do the work for them. Just like that vest, you keep that. If you need a vest to keep you upright, your muscles don't have to work. If your muscles don't work, your muscles atrophy. They shrink. Okay. Shrunken muscles are weak muscles. You take the vest off, boom, everything just going to fall. So you're going to end up actually debilitating yourself versus actually rehabilitating yourself. If you get my drift. When you say sharp pain shoots through you, I need to know what you mean by through you. You mean like down your legs, up your back? Does it shoot outwards? You was given a list of PTs. Susan Andre, look for anybody that's going to specialize in the spine. You can say that. Those different places that they have, you're looking for somebody that specializes in the spine, okay? Okay, somebody just told me that the other video was up. Yeah, we noticed the other track playing. I don't know where that came from. That was really weird. I got to go back and check that out. Hopefully it doesn't do it again. Yeah, Susan Andre, make sure you look for somebody that specializes in the spine. Specializes in the spine. Don't just go, do not, for the love of God, do not just go to regular therapists. Any of those places they recommended, you call those places and say, hey, my name is Susan Andre. I got, you know, this going on in my spine, that going on in my spine. I want to know if you have a therapist that specializes in the spine there. And then if they do say yes, tell them you want to talk to that therapist and want to know what's going to be your plan of care, what's going to be your plan of treatment. After that, then you can tell me what they told you, then I'll tell you if they know their stuff or not. I'm not trying to downshot nobody, but it's just that I know you. I want to make sure you're going to get the best thing done to you. So, but anyway, this last video, guys, is up. Okay, so I'm gonna go ahead and give you guys the link. There's the link to the video, guys. Okay, did I just give you guys the link? I will see you guys over there at the 11:45. All right.